Welcome to part 2 of Introduction to Hospital Pharmacy. Hopefully you had a chance to have a look at those questions put up at the end of part 1. So it's the chief pharmacist who's responsible to the chief executive for the medicines of use in a trust, and you could have chosen any one of those reports for the second question. We will now look at the main services that are offered within a hospital pharmacy. We'll do this by reviewing patients on a ward. So Mr. Lomax is rushed into your empty bed. He woke up this morning with severe chest pain. He was brought in by ambulance and he's got angina, which is basically getting worse, and he was admitted to your medical admissions unit. The medical assessment unit is where patients are admitted when they first come into hospital, and that can be direct from the community or they might come to the unit through A&E. The main aims of the units are to assess patients, make a diagnosis and plan the initial treatment, and pharmacists have a really important role here. The pharmacist will see all new patients on the admissions ward. They'll assess patients' own drugs and carry out medicines reconciliation. You'll cover medicines reconciliation more in part 2, although you will be observing this being done in your hospital placements. It involves taking a drug history from a patient and comparing it to the prescription drug chart and resolving any problems. We're there to advise the medical team on evidence-based medicine and rationalised medications. Is everything needed? Are there any medications that might be causing any problems? Pat checks Mr. Lomax's patient's own drugs, and she notices that his salbutamol inhaler has expired, so orders a new one. She then counsels him on the importance of ensuring that medicines are kept in date, and also checks in his inhaler's technique, so making sure that he can use that inhaler properly. Sometimes when I've asked patients for their own drugs, I get handed carrier bags full of medications, but you need to go through each medication with the patient one at a time to check that they are still taking it and how they are taking it. Pat, the pharmacist, notices that Mr. Lomax hasn't got his normal eye drops on his drug chart and contacts the doctor to prescribe them. If Pat had been an independent prescriber, then she could have prescribed them on the drug chart herself. This is quite a common error that happens on admission where patients' medication is not prescribed, and that is why it is a good reason for us to complete drug histories and medicines reconciliation. She also notices that he's running a bit low on his simvastatin tablets, so she orders a 28-day supply, and that is to be labelled ready for discharge. Hospitals are exempt from the need for a prescription when the sale or supply is made as part of its sort of normal business. The medicine is to be given to a specific person in accordance with a written direction. Now that written direction might be on the drug chart or within the patient's notes, and the medicine is to be given to the patient by an appropriate healthcare practitioner, so a nurse, pharmacist or pharmacy technician. So this means that a hospital drug chart does not need to conform to usual prescription requirements. And you'll learn about these prescription requirements later on in the year. So at the beginning of spring term, you'll start doing things like dispensing and prescription screening. This is what a paper drug chart would look like in a hospital. They're often several pages long, and nurses will sign the boxes for the medications when they're giving the medications to the patient. A pharmacist will clinically check the whole of the drug chart before supplying any medications to the patient. At the Royal Berkshire Hospital, we have electronic drug charts and an electronic prescribing system, and you'll get to review these when you come on placements in the following year. A pharmacist will clinically screen drug charts, and this is done at the start of the process to ensure that medication is clinically safe and suitable for the patient. This request will then be sent to pharmacy. If it's an electronic system, it will be done electronically. If it's a paper system, then this will be transcribed onto an order sheet by a technician or a pharmacist. Once in the pharmacy, the item will be labelled and dispensed either by a technician, assistant or robot, and then the item will be checked by a pharmacist, a check-in technician, or again a robot. In the case of a robot, they use barcodes on the medications to ensure that it's the correct product. Once everything's done and checked, the medications are put in sealed bags to make sure nothing goes missing between the pharmacy on the ward, and then a porter will deliver that to the ward. For any things like controlled drugs or fridge items, they will need to be signed for on delivery to the ward. You will find out more about how a hospital pharmacy works when you do your tours. This dispensary looks very peaceful and quiet, not the normal hustle and bustle of a hospital pharmacy. At the Royal Berkshire Hospital, we now have less drugs on the shelves because we have a robot. It's set out similar to community pharmacies, but obviously larger. You tend to have a walk-in fridge, a CD room rather than a CD cupboard. Medications are stored in alphabetical order, just like in the practice lab here at the university, where you'll be doing your dispensing later on in the year. If you do have a robot, medications are stored much more efficiently, saving space, and in the dispensing process, different people are involved in different steps of the process. Screening tends to be done on the ward by pharmacists, labelling by the technicians, dispensing by technician or assistant, and checking either by a checking technician or pharmacist. Wards usually have a stock list of drugs that they commonly use, and this prevents us supplying every drug to every patient. The wards and departments are normally topped up regularly, so a bit like your supermarket shop, and this is done by the pharmacy assistants and technicians through pharmacy stores. Effective purchasing is very important to keep down cost. We tend to purchase in large quantities, and we use generic medications rather than brand names to keep costs down. Sometimes several hospitals or trusts have joint contacts to try and get better value for costs of medicines, and we also have a formally list of drugs this is a list of drugs that we are allowed to use within the hospital, and this helps to manage costs and helps prescribers and pharmacists to become more familiar with these medicines while out on the wards. We are now back on the ward, and Mr. Lomax has been transferred to the cardiac ward, and his bed has now been filled by a new patient. Mr. Smith has been admitted with a rash, and Mr. Green, the consultant, thinks that the rash has been caused by a new medication. There is no drug name on the box because it's a clinical trial medication, and this can be quite common with clinical trial medications. You don't always have the drug name on there. Sometimes you'll have just the clinical trial details. So Dr. Green comes to find you and asks if you can find out if the medication can be identified. There will be procedures in place to find out what the medication is between the drug company running the trial and obviously the hospital clinical trials department. The drug company and the trial doctor will need to be informed of the reaction that Mr. Smith has had. The Pharmacy Clinical Trials Department is responsible for assessing clinical trials for suitability and feasibility. They write the protocols for the dispensing process. They'll provide records for the company running the trial, and also provide training for new trials started within the hospital. There are lots of extra paperwork involved when dispensing clinical trials because everything has to be documented and fed back to the drug company. After finding out the name of the medication, you return back to the ward again and focus on your next patient, which is Mr. Hughes. Mr. Hughes has had a stroke, and this has affected his ability to swallow, so the nurse is having difficulty giving him some of his usual medications and asks you for advice on what to do. The Medicines Information Department provides advice on anything relating to medicines. Inquiries can be from any hospital staff, community pharmacists, GPs, district nurses, anyone really who's got a query. The department is based within pharmacy, And most of the information now is available online rather than using lots of different textbooks. Some hospitals will have a helpline for patients that have been discharged from hospital for queries about their medications. After finding out how to adjust Mr. Hughes's medication, you return to the ward to review your next patient, who is Mr. Davis. Mr. Davis is due to have chemotherapy. Chemotherapy only has a short life once it's made, so it tends to be made ready to order, and it's been prescribed for Mr. Davis electronically by the consultant oncologist, who is a specialist in cancer care. The nurse informs pharmacy that Mr. Davis has arrived ready for his chemotherapy. Technical services, or aseptics as it can also be called, makes items to order. This might be chemotherapy, intravenous nutrition feeds, creams, ointments, eye drops, or antibiotics. And you need special facilities to avoid contamination. Protective clothes will need to be worn by staff to protect them and also protect the products they are making. Products are made up in a sterile environment to avoid contamination, as the patient is at increased risk of infection. The pharmacy department prepare the chemotherapy for Mr. Davis and send it up to the ward when it is ready. Mr. Jones has been admitted overnight. It's now 2 o'clock in the morning, and he has been seen by the night doctor, who decides that he needs intravenous antibiotics but isn't quite sure what to prescribe. So she calls the on-call pharmacist. The need for a 24-hour access to a pharmacist was highlighted in the Nuffield report. The on-call services may be delivered from home or through a residency service and is intended for urgent items only. A residency services tends to be for those big busy hospitals and you're on site working through the night. If working from home, you can be bleeped at any time and you are still expected to work your normal week. So you might get called at 2 a.m. in the morning but still be expected to be at work by 9 o'clock the next morning. Some things can be dealt with over the phone from home, and sometimes you might have to go into the department to dispense medications. It's a lot easier now with electronic records because you can access more information from home, and if the pharmacy has a robot, you can sometimes issue items, dispense items from home as well. Mr. Lomax is feeling better and is ready to go home, and typically the doctor tells him at 9 o'clock in the morning on the ward round that he can go, but doesn't write that prescription until a lot later in the day. The nurse bleeps the pharmacist to come to the ward to come and screen it. Once it's screened, it can then be processed by the assistants and technicians in the pharmacy department. The use of patient's own drugs and one-stop dispensing where possible can reduce the number of items needing to be dispensed in the pharmacy, which speeds up the process. The discharge medication, or TTO, which stands for to take out, is supplied using the patient's own drugs and extra items dispensed through the pharmacy. The items are then put in a green bag and this is sent back to the ward where the pharmacy technician counsels the patient on his new medications. The green bags are used to keep all the medications together, and typically this is what ambulance drivers will look out for in patients' home when they're bringing patients in. That brings us to the end of our session. So we've introduced hospital pharmacy and had a look at the different sections within a hospital pharmacy and all the different roles, discussed some of the regulatory and policy framework relating to the management of medicines on the NHS, and described how medicines are supplied in hospital. So we've come to the end of our session today. If you have any questions, then please don't hesitate to email me, and I look forward to seeing you in your placements.